Morning, my name is Kelly Akina, and I am the physician that's going to diagnose Gia Laranji, in this case versus Maryland. So, in this criminal background, Gia was diagnosed with bipolar disorder at the age of 16. Her father has bipolar disorder, and she's being charged with committing suicide by jumping in front of a car and killing the driver. And so she's being charged with involuntary manslaughter, and her sentence is up to 10 years in prison. There are two types of bipolar disorder, bipolar 1 and bipolar 2. Gia expressed the symptoms of depressed mood, loss of interest, and attempting suicide. And let's look at the physiology of a normal brain. So, several of these areas that are shown in the figure are frequently studied in bipolar disorder, and these are going to include the prefrontal cortex and the anterior cingulate cortex. This image shows the thalamus, the hippocampus, and the amygdala. So the amygdala is going to be a subcortical area, which is a major player in the brain's reaction to emotions. The anterior cingulate cortex is a part of the cortex that has strong associations between the prefrontal cortex and the limbic system, and is thought to play an important role in regulation of strong emotions. The hippocampus is located in the cortex and is especially important in learning and memory. And the prefrontal cortex is a section of the cerebral cortex that is highly developed, and that's going to be involved in regulating complex thinking and behavior, and it's going to be considered a center of judgment and planning. This picture shows a significant reduction in gray matter volume. It's an image of a bipolar brain, and it shows how a normal brain also looks like, OCD brain, bipolar brain, and how a depressed brain looks like. And so the gray matter shrinking prefrontal and temporal regions of the brains are a great indicator that someone has bipolar disorder. In this picture, there's a view of the normal brain with a patient, in contrast with a patient who has a bipolar disorder, and they have enlarged ventricles. And so the bright white spots of the hyperintensity is going to be associated with the bipolar illness. Um, and now let's look at this other figure here that's gonna again show how there's a gray matter reduction in the frontal brain regions, which is gonna be involved in self-control. While the sensory and visual regions are the ones that are going to be in the gray color, and you can see how this is going to be altered in a bipolar brain. So there are these two neurotransmitters that are going to be involved in bipolar disorder. There's serotonin, which deals with sleep, wakefulness, eating, sexual activity, impulsivity, learning, and memory. And so abnormal functioning of brain circuits that involve serotonin as a chemical messenger that are going to contribute to bipolar. The other neurotransmitter is dopamine, and that is going to regulate the pleasure and reward emotional pathway. But when it's disrupted in patients, normally they get symptoms of psychosis and schizophrenia. These are my references, and thank you.